let's shift our attention to the health sector, where the federal government has approved the release of some about 25 billion naira for primary health care in Nigeria. The essence of this fund is to improve over 8,000 healthcare centers in Nigeria. Now, what will be the impact of this fund, and how should it be utilized in order to improve the state of primary health care in Nigeria? Let's shift the conversation to our special guest, who's going to provide our perspective in this regard. We're being joined by Mary Agholor, who is a registered nurse and also a public health advocate. Glad to have you join us, Mary. It's been a while.
Good morning, Femi. Yeah, it's really been a while. It's good to see you again.
Yeah,
How
great.
are you?
Always a pleasure to have you here. All
Thank
right.
you. Thank you.
Now,
It
when
is
you
a
hear
pleasure.
this kind of story about money being approved, this is to the tune of about 25 billion naira for the improvement of primary health care in Nigeria. The essence of this is to improve over 8,000 healthcare centers in Nigeria. What comes to your mind, and how will you react to this kind of story or development?
Thank you very much, Femi, for that question. To start with, I would like to say thank you to the federal government for at least remembering the public health sector, the primary healthcare sector in their policy making, and looking at it from the angle of primary healthcare centers sector being a path of healthcare that is not usually very much paid attention to. So if I'll just say we appreciate the government for putting us in mind, keeping this aspect of healthcare in their agenda, at least positively for this period. So how will I react to this? Yes, I'm happy about this. It gives us a sigh of relief, to know that the poorest of the poor in Nigeria can now have easy access to healthcare, because primary healthcare generally is supposed to be the healthcare section that should be easily accessible and available to the common Nigerians in the suburbs, in the rural areas, common Nigerians who cannot afford the secondary and the tertiary healthcare. And aside that, the primary healthcare is also supposed to be the first line of the first place of call for anyone in a community who has a healthcare issue. You assess the primary healthcare center first before you are referred, if your case would need referral, and you're referred to the secondary or the tertiary institution. And it's been unfortunate that for so many years now, the state of primary healthcare centers in Nigeria has been in a very sorry state, because when we public health advocates organize medical outreaches to these rural areas, you hear this rural dwellers telling you about the fact that they've not seen a doctor in a long time. There are no facilities in the primary healthcare center in their village. There are no drugs. There is no one. Nurses rarely come. Doctors rarely come. And they just go there. It's as if the primary healthcare center in their village can't even help them. So when they see opportunities of medical outreach being brought to them, it's like they just got a health messiah coming to assist them. So the fact that the primary healthcare centers in most rural areas are already in this sorry state, now seeing these developments coming in with the 25 billion naira being disbursed to develop the primary healthcare center, it is a sigh of relief. And for me, I am hopeful that this money would definitely be put to use, and we will definitely see the results. It's one thing to disburse an amount of money, and this money is quite huge, but it's another thing for us to see the result of the disbursement. It's another thing for the people who are put in charge, or the organizations, the sectors who are put in charge to put this money to use, to actually really put it to use and ensure that there is accountability, for everything, accountability and transparency for everything that the money is being used for, so that the common Nigerian that is supposed to enjoy the effect of the money being disbursed to the primary health care would definitely be able to come out and smile and say, oh, the money has been disbursed and we've seen the effects, we are enjoying the effect. Thank you, government, for doing this for us. And we hope that that appreciation would definitely be the end result of this disbursement.
Thank you, Mary. As we already know that the state of primary healthcare centers in Nigeria currently is not what it should be. Only about 20% of about 30,000 primary healthcare centers across Nigeria are fully functional. Now, this fund that is being drawn from the Basic Healthcare Provision Fund targeted towards 8,000 healthcare centers. That's like a fraction of the whole, the entire number of healthcare centers that we have currently in Nigeria. So providing the basic operation cost and what is needed to run healthcare centers, we're hoping that it will improve. But what would you recommend that this fund be channeled to? Because it's not as if new healthcare centers will be built. It's just to make them fully functional. You've seen the state of some of these healthcare centers. Specifically, what do you want this money to be channeled into? Is it for provision of drugs, for beds, or for hiring of the healthcare personnel? What are your thoughts on this?
Yes, you already mentioned some of it already. Starting from the hiring of healthcare professionals, we actually need more healthcare professionals in the primary healthcare sector. We need more healthcare professionals. That one is basic. In fact, it is not contestable. We don't have to contest that. Definitely, I would recommend that part of the money should be put into hiring. And aside hiring, the healthcare professionals that are already on ground, how much are they being paid? What are the incentives? What are the things you're doing for them to actually encourage them and to motivate them into delivering their jobs effectively? So, but according to reports, I read that the disbursement is majorly for direct facility financing and workforce incentives, which is actually really cool. I agree with them. I agree with the government on that. Direct facility financing is one major way that they can do this. Now, direct facility financing in the point of providing more equipment, providing medications, providing. I have seen a primary healthcare center that does not even have a SPIG. A sphygmomanometer is an equipment we use in measuring blood pressure for patients. Anybody who comes to the hospital, the first thing we do is to carry out a vital sign. And vital sign is checking temperature, checking respiration, and the blood pressure of the patient. So when you don't have the equipment to even check the basic assessment, do a basic assessment for a patient. So how do you want to even treat the patient? How do you want to diagnose the patient? How do you want to care for that patient? So facility improvement is very important, providing equipment, providing medications. In rural areas where most primary healthcare centers are located, there are no big pharmacy shops or pharmacy companies or something that they can easily go and get these medications. If it's in the town, if it's in secondary healthcare, sector and cities, if patients cannot get a particular medication in the hospital, you can easily just prescribe it to them, give them the prescription sheet. They will go out there to some quality chemist shops or pharmacy shops and they will buy it because they can afford it. But in rural areas, they don't easily have that. They don't readily have that, places where they can buy these things. So they have to actually get these medications from the center, from the health center where they are being treated. So that's one. Now, two, I'm happy. I read a report that it's some of the money is also going to be pushed into NHIS, because NHIS is also one of the organizations that the money will be disbursed through. Like it will be disbursed through the National Primary Healthcare Development Agency and the National Health Insurance Agency, which is actually very cool. Looking at it from the angle of NHIS, I am a strong advocate for health insurance, because health insurance is key for Nigerians, especially for the common Nigerian. But everybody needs health insurance. And I feel health insurance is not given enough publicity, is not yet given enough attention. So if some of this money is actually put into health insurance to reduce drastically out-of-pocket payments for healthcare, this will go a long way in helping the common Nigerians who cannot afford healthcare. You know, a situation whereby someone falls sick, you know, a child falls sick, the parent takes the child to the hospital, and you get there and you have billed a particular amount of money, or you have paid for card, pay for consultation, pay for drug, pay for laboratory tests, pay for this and that, and then the person doesn't have money. Of course, sickness does not write a letter to you that you're going to fall sick next week, prepare for meal, you know. So people fall sick unexpectedly without, some people even fall sick, and because they don't have money to go to the hospital, they just stay at home and start taking all sorts, you know, in the house just to get better because they cannot afford healthcare. So all these are the problems that NHIS, health insurance, will help to solve. So if part of this money is put into NHIS in providing health insurance for the common Nigerians, for the poorest of the poor, for the Nigerians in rural area, for the common Nigerians who cannot afford to even feed, not to talk of being able to pay for healthcare out of pocket. So if you help to give them health insurance for a whole year, they can go to the hospital anytime they are sick and access healthcare without having the issues of headache or of the fact that they don't have money to pay. So answering your question, basically, I would say part of the money, priority should be given to health insurance. Priority should be given to providing medications and equipment, basic equipment that befits a primary health care. Now, when you want to provide basic equipment for primary health care, you look at what are the services that primary health care, a typical primary health care, should provide. Primary health care is the first call of health care. So you don't expect that surgeries will be performed in primary health care centers. You don't expect that major procedures we perform in the primary health care. Of course, if you want to undergo such major procedures, you go to secondary health care or you go to tertiary. But what are the basic procedures being performed in primary health care? What are the basic things that patients would easily come to access in primary health care? Immunization, you know, emergency, first aid, delivery, you know, maternal and child care, everything that has to do with maternal and child care. Because a woman in a rural area who wants to give birth would definitely go to a health center closest to her to register for antenatal and have a delivery there. So every equipment we need for maternal and child care, to provide antenatal care, to provide for labor, to provide delivery, to provide postnatal care. Then family planning services should be offered at primary health care centers too. And of course, primary health care centers should be able to treat basic illnesses, you know, common illnesses like malaria, you know, typhoid. And then a primary health care center it should have a laboratory. A good laboratory actually should be in a primary health care center, because definitely there are some tests, there are some medical tests that some patients would want to undergo, and you cannot start sending them to township from the village just because they want to do a malaria test or wider test or whatever, blood sugar test or anything. So these are part of the equipment that need. So it is really basic. It's not a lot. So definitely part of this fund should be allocated to this. You know, provide medications, provide these equipment, and then incentives for the professionals. If you want professionals to be happy, you have to do them well. You have to treat them well. So it is one thing to employ more professionals. It's another thing to take good care of them. You know, incentive for professionals. It is really not easy on professionals to leave their family in town and then go and work in this primary health care center. So you have to actually really encourage them. And thank God we have various professionals who actually work in primary health care centers. So it's not just the doctors and the nurses, the registered nurses. We also have the community health extension workers working in the primary health care centers, and community health extension workers have actually really been doing well in this field. You know, most of them actually work in these PHCs, and they show up, so nurses are there, doctors should be there also, and I would like to talk to the professionals. The professionals should not look at it that, okay, because the primary healthcare center is a small platform, so they will rather prefer to go and work in the bigger platform, which is the secondary healthcare or the tertiary institution. So if government is putting their weight behind us in providing all these basic things we are mentioning and ensuring that everything is fine with primary healthcare centers, then the professionals should also do their bit in ensuring that the community people, the citizens, have the best of care in primary healthcare center.
All right, now let's talk about the issue of transparency, because when it comes to the issue of allocation of funds or the utilization of those funds, the greatest concern has to be the issue of transparency and even accountability. Now, what kind of mechanism do you think can be put in place to ensure that the process is transparent and this kind of funds are utilized for the purpose intended?
Thank you very much. I really, that is the major for this discussion, because like I said earlier when I was answering my first question, it is one thing for money to be disbursed. We all hear it, we cheer, we are happy and everything. It's another thing for us to actually see the results and the major improvements that we expect from this allocation and everything. Now, so many instances we've had a lot of money being disbursed to healthcare, to this sector, education and everything, and then we still don't really see the results, or maybe you just see the results a bit and then later on everything just goes haywire and nobody can explain what actually went wrong or at what point did anything go wrong. So in ensuring transparency and ensuring that the people who are actually supposed to benefit from this are benefiting, I feel some maybe committees, or agencies can be put up, to look into this and put their searchlight into everything that is being done, put their eyes into everything and monitor everything that is being done in primary healthcare centers, especially the ones that will be funded. Not everything will be funded after all. So, but the specific ones that will be funded with this particular allocation, some committees can be set up and to ensure that there is transparency, to ensure accountability, to ensure that there is report of how this is being spent, how this money is being put to use and all that. And from the angle of the citizens who will be enjoying the benefits of this disbursement to the development that will be coming up at the primary healthcare center through this allocation, the people should be given an opportunity where they can actually report. The people should be given an opportunity where they can actually come up to evaluate. They can come up to evaluate the services. Okay, if this primary healthcare center in Ogun State, for instance, is one of the centers that has been developed as that money has been put to buy this, to buy that, to develop it so that people can be able to access also healthcare facility, then there could be a suggestion box, there could be an evaluation box, there could be an opportunity. Let's devise a means where anyone who comes to that healthcare center to assess care can actually be able to say, oh, I was well taken care of. Oh, I was, something like a review, those who enjoy these services should be able to give a first-hand review of the services that was rendered to them so that we can be sure that, okay, really, this primary healthcare center was funded and the people who assess the space are actually getting the results they are supposed to get. And then this thing with being able to report, there should be a particular body where people can actually report if something is not going well, some things are going wrong, where they can actually say, oh, this is not going well, this is going wrong, this was done wrongly while I was there, this was, something like that. So let's just put in a measure whereby people can actually can report an irregularity. Those who are in charge would sit tight and ensure they are doing the right thing. But if there is nobody checking, if there is nobody evaluating, if there is nobody reporting, if there is nobody going back to say what is happening there, or if the people who are enjoying this are not given the opportunity to speak out, to say their mind, to say what is going wrong and what is not going wrong, those who are in charge will definitely do whatever they like, and everything will just fizzle out like that, and that's it. And we'll just all forget about it. We'll just complain and forget about it eventually.
All right, wrapping up, the Ministry of Health has said that the Basic Healthcare Provision Fund has been redesigned, and once that is completed in July, there are hopes for additional investment into primary healthcare centers, and this focuses on maternal and child care services. Now, have you spotted, or what do you think are some of the challenges with providing high quality or good enough quality maternal and child care services in the primary healthcare centers that should be the next line to be invested in after this time?
For maternal and child healthcare services is one major service that is being provided by primary healthcare centers, and this should be the first stop for every woman who wants to deliver, who wants to have a child, who wants to bear a child, for antenatal, for delivery, and for postnatal care. So one major way that I believe that governments can actually help the primary healthcare center in providing quality maternal and child health is to improve the immunization services in primary healthcare centers. Let us invest more in immunization services in primary healthcare centers. When you're talking about ways to reduce child mortality and morbidity, prevention is better than cure. So preventive measures of reducing child mortality and maternal and child mortality and morbidity, because it goes from the mother to the child from 0 to 5 years. So if we want to improve their health, we should look from the angle of prevention. So prevention, they say, is better and cheaper than cure. And one major way to prevent illnesses in maternal and child is through immunization. So if we can buffer up our immunization services, immunization to pregnant women, immunization to children 0 to 5 years, all the special immunizations that should be given to children should be readily available and for free. I repeat, all the immunizations that should be given to pregnant women and children 0 to 5 years should be readily available and for free to every one of them who come to access primary healthcare centers. So immunization, vaccination, very, very important way of preventing childhood illnesses. It's very important in preventing childhood illnesses if we really want to improve maternal and child health. So I feel the government should actually invest more in immunization. And then after immunization, then I will talk about the antenatal care. Antenatal care, if things are going to go wrong on the day of delivery for a pregnant woman, it is possible to actually see it coming already during the antenatal care. So if antenatal service is top-notch, if antenatal service for pregnant women is very cool, is very okay, is very professional, is quality, then we will have a reduced number of stillbirth, we'll have a reduced number of maternal death on delivery days. So during antenatal care, every facility that should be in place to check a pregnant woman should be in place. The ultrasound scanning, the vaccination for pregnant women, the care, everything that should be in place, all the tests that they should carry out on pregnant women should be in place so that there won't be any negative eventualities during their delivery days. Because if there is anything that will go wrong on delivery day, most of the time we see it coming already during antenatal. But in some cases, primary healthcare centers, they go for antenatal care, and the only thing they just go to do is to dance and sing, and that's all. You know, dance and sing in the sense that, of course, we at antenatal, the pregnant women come, we educate them, they sing, we make them do some small exercises here and there. That's where the dancing come in and all that. No tests, no medications, no nothing, no ultrasound scan, nothing, because the healthcare center does not have the facility for it. And on the day of delivery, the woman will come with her pregnancy to come and deliver a child, and it is on that day we're seeing that, oh, this woman has a incompetent cervix, so this woman has a this, there is fetal distress, there is maternal distress, there is this and there is that, and then the child dies, the mother dies, the child survives, you know, all those stuff. And then I give you an example of the fact that I have seen a primary healthcare center that does not have a SOUQ. Yes. And I tell you, a primary healthcare center that does not have a SOUQ, how do you want to check the blood pressure of pregnant women? Because preeclampsia is a major problem for pregnant women. A woman who has high blood pressure in pregnancy is at risk of losing that child or losing her life at delivery. So if we don't have something as simple as a SOUQ to check blood pressure for pregnant women, so how do we want to improve maternal and child health and reduce maternal and child mortality and morbidity? So let us invest more in immunization for pregnant women and for children 0 to 5 years. Let's invest more in facilities that will help to cater for antenatal care, delivery, and postnatal care. Thank you very much.
All right, Mary, we just have to leave the conversation here. No doubt you've done justice to this, and you've spoken from your own experience. So let's hope that with the approval of this fund, the primary health care centers in Nigeria will be better for it. We most appreciate you for your time and your submission on Early Exchange this morning.
Thank you very much for having me. It's always a pleasure to be here.
Early Exchange, shaping policy, advancing development.